So welcome to the building. You meet at an exciting time, obviously change of government, but it has to be said that governments all around the country and our predecessor government made really good faith steps in this area which do have to be continued. There's no such thing as saying that we're almost there or the services are adequate. I was just looking through budget papers the other day and noting that a couple with a combined income of $60,000 with a 70-30 split receive about $14,000 in additional payments from the government. And they are a family with 3 children and no complex needs whatsoever. This is a hypothetical family, of course. And you might think if there was a marginal $1,000 then, if there was another $1,000 cheque, would it go to a complex needs family? And the answer is no, because that family gets $15,000. So I like to think at the margins of just how much money is being transferred around the country to remember just how hard this battle is to make sure that that extra $1,000 actually went to a family that would so dearly be able to invest that in better social and economic and emotional and clinical health connections to the community. What I guess you will see as a pervading theme will probably appear in the McClure report, which is due to be released after the final report has been shared with the reference group. And certainly Patrick's already mentioned some of his key areas of focus, and they are building a more sustainable and simple income replacement and welfare system by building individual capacities, connection to employment, working with employers, and obviously building community capacity, which in and of itself, I guess we tend to forget that element because government has no control over it, but that really is the ability of the community to find solutions and to be able to reach out to families in greatest need. So that will be an important report which we're looking forward to seeing. I wanted just to touch on some very brief areas before we hand over to Chris, and that would be the FAMS, as it's known, the Personal Helpers and Mentors service. There's also the complex needs scheme, complex cases scheme that's there for humanitarian entrance, protection visas and refugees, which I think is a really important step. And then of course there is the flagship NDIS and the overarching National Disability Strategy that everyone should know about, providing that strategic 10-year planning process and also locking in all 3 levels of government towards those commitments to make sure that we don't simply say, now the NDIS is here, we can let funding slip away in other important areas. The NDIS in and of itself can't stand alone and will fall away if we don't keep the buttresses around it, which are the other related services. So I used to be GP about 20 years ago in a town just up the road, and I was there in a 2-doctor town, and that was the first time ever that I'd been out of a public hospital into a context where I was just meeting families. So family members would come in and sit with me, and I was obviously, as a new arrival to town, poorly briefed on what the support services were, but I just saw extraordinary sacrifice made by families who had effectively changed their entire life, knowing that they had to devote all of their energies to loving a family member that had really complex needs. And that could be someone with intellectual needs, suffering from epilepsy, completely uncontrolled, as they grow older, potentially more problems with behavioural issues and potentially violence. So these are issues that you know intimately, but for me I just got this touch in my professional life, and I was absolutely at my wit's end because there really wasn't much I could do. There was a couple of people at the hospital I could call, and you just prayed that they had neighbours and friends who gave them support, and then you'd cast your mind to whether you could actually cope in that situation. And so often I couldn't even understand how I would cope in that situation. So that was pretty startling, and you just hope that things are maturing over time and that we are understanding some of these needs, and also not just in a compassionate sense, but in an opportunity sense. And if there's one area that I think there will be movement, it's accepting that a lot of these people with really complex needs would dearly love to have a capability which opens the door to opportunity. And if that is a sense that they can be employed, for instance, and have gainful engagement with the community in respect to some form of work, then suddenly you're shoulder to shoulder with other people, there are new social connections, obviously with it comes skills and potentially in some rare cases, but probably not that rare, some high levels of financial independence, certainly more financial ability to do things with your own money rather than being utterly reliant on welfare 100%. So for people at the margins, we know that in many cases mental health is a significant barrier, so about 30% of our DSP recipients have significant mental health issues, And while that's just a throwaway number, you just need to imagine how it is for an employer who would dearly like to take on people with complex needs, but is having to deal with that fluctuation and oscillation in capacity, and just has to appreciate that sometimes it'll be half a day's work and other days the worker won't be there. So for employers who have that capability to be flexible enough to engage those kind of citizens and give them a chance, then we really want to support that as much as we can as a government. I think there is still some interest in the community about whether the NDIS will be a cure-all, and if I had one caution, it would be that I've really tried to emphasise that not everyone will be eligible for the NDIS, and that there'll be particularly in a number of areas fairly absolute criteria about that eligibility. I don't claim to profess to know all of those yet, but it's very important that that people don't simply think that that's the next big thing, when potentially the NDIS is specifically there to provide the social and the emotional, and hopefully the potentially in some cases the economic opportunities for people in greatest need and working backwards. So I just wanted to make sure there wasn't a sense of over-promising around the NDIS, but what you want to know today is that all governments, state, territory, local, are locked into an agreement and are working ahead with a pretty clear strategy over the next decade. Look, in conclusion, it's wonderful that you can come here today. I'd like to see the next meeting held on the sitting day so that we can capture some of the, those opportunities to grab some of the MPs that can't be here today. But I'd like you to forgive us that we can't stay for the entire day. But thank you very much for including me and allowing me to speak on behalf of my side of politics, and also to Chris, who will follow me. Be kind to me, sir. We're working closely with ACT, and in a particular area of my interest, if you allow me to just put a footnote, we've talked about the needs of younger people with complex needs. We obviously realise that it's in school and the school systems that your government is responsible for. But what's really interesting now is this move into the 0 to 5 space. And again, while states often are running the obstetric services and doing the follow-up care with home visiting nurses and other really exciting programs, biological vulnerability is about 5% of the population. But by the time they hit school, it's about 25 to 27%. What are we doing in that 0 to 5 space that leave kids at the age of 5 unable to hold a pencil properly, not knowing how to open a book, unable to regulate their emotions, not knowing basic letters? And then, of course, we expect the school system to pick all of this up, and the school system is not equipped to do that. So if I can do one thing certainly in the next term or two, I want to see a sort of a laser-like refocusing on the 0 to 5 space, which currently falls between the cracks simply because we never realised how important it was when we designed school systems. I think if we did design school systems today, realistically, there would be some early reach out as early as 18 months for the families that most need it. So in these areas of vulnerability, which I'm really, really concerned about, if you have ideas in this space, Paul Kershaw has done really significant work on the Canadian economy. He's talked about what it takes if we can get half a standard deviation movement in our school scores. 20 years ago, we would have a GDP increasing 0.63% faster every year, just by moving school outcomes. If you go back into the early years, if we can reduce those numbers of vulnerability from 25 and start bringing that back to 20, there's nothing that says there have to be vulnerable children aged 5. There's nothing that's absolute about that. There shouldn't be any. If we can reduce that number, it can have enormous economic outcomes. You know them: completing school, not having a teen pregnancy, not hitting the incarceration screen, or having a criminal resume longer than your capability resume. We know it can treble your odds of getting into school, into college and graduating university in the States with RCTs that look at this 0 to 5 space. So please include that in your thinking, because at the moment I think it's an area of enormous opportunity for childcare systems being reviewed, and for the interactions between what the federal government does in its provision of GP and Medicare services, where vulnerable children come in and out of doors every day of GPs, and all they get is a jab and sent on their way. And at the same time, we have schools that are wearing this enormous burden. And then we talk about school ratios because you've got 27 kids. Well, it's not the 27, it's how many have special needs, how many have behavioural issues. Because not only do they, as you know, soak up all the resources and the time, but they disrupt everyone else's experience. So at every level, we need to be focusing on those children before they get to school. Thank you. That's just one of those exciting challenges, Melanie, but thank you also for allowing me to go slightly over time. Thanks, everyone.
Thank you so much.